This week, we're looking at the concept of interprofessional practice. This lecture will specifically focus on using telehealth in a primary care setting. So first, what do we mean by a primary care setting? For the purpose of this lecture, I'm going to use the term primary care setting to refer to specifically hospitals, but also to some extent outpatient sort of specialty care facilities. So first, who is using telehealth? If we look at the hospital setting, who in the hospital right now is using telehealth? Well, the main answer to this question is a lot of people. Specifically at the VA hospitals, physicians are utilizing telehealth services to treat clients or treat patients in a way that really they've never been able to treat them before. So physicians are using telehealth services to assess patients who have actual injuries or diseases, but may not be able to get to the hospital themselves. So you could have a client, if we want to kind of think of an example of who would be using telehealth services in a hospital setting. We might have a client or a patient who is monitoring their diabetes. One week they notice that they have a flare-up in their diabetes, and they're not quite sure if it necessitates an actual inpatient hospital visit or if they could potentially just monitor it at home and maybe address the issue using kind of less intense care. So this patient would be a perfect candidate for telehealth services with a physician who would otherwise be working in a hospital. That person could utilize some sort of video conferencing platform and connect with the hospital attending physician, for example. And in that video, they could actually physically show the hospital attending physician their injury or describe their symptomology in a really kind of vivid way that allows the physician to assess what's going on by just looking at the client and talking to them over video conferencing. Sometimes the client or a patient will need maybe additional assessment. So it wouldn't be uncommon for a physician to say, okay, we've kind of talked about things. Maybe you showed me the site of a wound that you have that isn't healing. Right now, what I'm going to have you do is go to a lab and maybe give them some blood work, and then the lab will send me that information, and then we can connect again in a couple of days using telehealth again, and I can give you a better sort of prognosis, or I can give you a better treatment plan. In a case like that, the physician has been using or is using telehealth as a way to reduce the amount of time it would take for that client to see the physician, and then also reduces the amount of time that it would take for that individual to get the results of their tests. Because typically if one goes to a lab, they have to wait until they're able to make another appointment with a physician to be able to get the results of those tests. Using telehealth, it would reduce the initial assessment visit, and then it would also reduce the visit where your hospital attending or other maybe outpatient physician's unit would be looking at your results. So that's kind of just one example of how a physician would be able to use telehealth care in a primary care setting. If we look at other ways that professionals in primary care settings are using telehealth, another one is just through training. Sometimes trainings are offered in states or even other countries that we would love to go to, but we aren't able to just because traveling so far would be very cost intensive. By using telehealth to provide trainings to hospital workers or physician's office workers means that staff members are going to be getting the best education possible from all around the world. Obviously, having a better educated staff is going to lead to better client and patient outcomes too. And then last, when we look at staff using telehealth care services, in addition to treating clients and getting education, staff are also using these services just to work with other professionals at other institutions. A nurse might get on a video conferencing system and contact a professional at a different hospital who's experienced an injury that maybe they haven't experienced before. So again, it increases the level of care and services that staff are able to provide patients in the primary care setting. If we look then at hospitals specifically, and even more kind of poignantly, emergency rooms in hospitals, right now, telehealth would really reduce the burden on emergency centers to provide care for everyone that walks in. Unfortunately, they say that sometimes up to about a third of the patients that come into an emergency room or an acute care kind of setting actually don't need that level of services. So patients are coming to the emergency room, for example, to have an injury looked at or a disease kind of monitored that really don't necessarily need to be there. They could have been seen outpatient or by their physician at an outpatient unit. So by allowing patients to access telehealth care through their outpatient units in a really easy way would reduce the individuals who come into the emergency room just looking for treatment of some kind. So that allows hospitals to really focus on the actual 70% of people who need to be there. Being able to focus their attention on the 70% of individuals that need to be there would not only improve health outcomes, but it's also going to reduce wait times for people in emergency rooms. And then kind of last, if we look at telehealth care in the primary care setting, above and beyond how we're using telehealth care to train staff or how we're using it to increase outcomes for our clients, telehealth care in hospitals and other maybe outpatient physicians' offices really does improve internal finances. So telehealth reduces costs and increases effectiveness. Physicians are able to see more patients at a time. So if you think a traveling physician, for example, might take 20, 30 minutes to get to and from different clients' homes if they were going to be doing home visits. Telehealth allows physicians to see clients kind of back to back without that travel time infused into their day. This, like I said, not only reduces cost, but it also increases the really amount of services we're able to provide to patients. In addition to this, it's been shown that telehealth services reduce readmission and length of stay at hospitals, which is really something that hospital business people have to consider very heavily in, kind of the administration side of running a hospital. We always want to reduce readmissions. If we're reducing a readmission, it means that we were able to help somebody the first time that they came in, and now that person doesn't need to continue to keep coming in to monitor their condition. And then one thing that I did want to kind of say about this is we've had some obstacles in the past about insurance not covering telehealth services. With recent legislation and policy that's been enacted at the state and federal level, we've really removed a lot of these barriers and have expanded health insurance coverage to include telehealth services. So again, that's going to increase access to care, it's going to improve health outcomes, and it's really going to mean that more clients are getting served in ways that they otherwise wouldn't be able to get served.